Hi, this is Justine Calderwood, physical therapist at the Healing Spot. Today I want to talk and give you a little bit of information on ways to relieve shoulder pain. So this is a very non-specific blog post, and basically what I'm going to talk about is just pain that's radiating from the shoulder joint, whether it be coming from a variety of diagnoses. Okay, so I'm talking about pain that radiates here, maybe down into the arm, up into the upper back. Sometimes that can affect the neck. So I want to just start this by saying I'm going to give you some tips, but I really believe the best way for you to get some individual customized help is to actually seek out a professional physical therapist in your area, okay? So they can evaluate that, because sometimes neck or shoulder pain is coming from the neck, okay, and that really needs to be evaluated. But these are some good tips to try, and I'm going to talk about how to use a little inflatable ball such as this to release some of those areas in your for yourself. So I'm going to use my bed here, and I also want to say I'm doing this more for demonstration purposes, but also just to draw awareness that using the bed, this is going to be a lot softer. So if you're in a lot of pain or your muscles are very spasmed up or tight, this is a great place to start, but you may have to switch to the floor at some time, okay? So start on the bed, move to the floor as able. And we're just using a small inflatable ball. This can be found in a department store, and I just give one of these to every one of my patients. So to start from releasing the backside, so say you have some upper back tension, pain, what you can do is actually use the ball, find an area that feels with those symptoms, and what you're going to do is lie on top of it. So I'm just kind of picking this area up into the upper trap area, and what you can do, I'm going to move over here a little bit, you can put the ball directly there, and then depending on your mobility, you can bring your arms out here to the side, and you're just trying to open up a little bit and allow the ball to press into that area. And you want to hold for a minimum of 3 minutes, but ideally 5 minutes or longer. It takes the body about 2 minutes to start to respond, to do that myofascial release, to release the soft connective tissue, and so you don't want to stop too soon. Okay, so that's an area you can certainly use that anywhere along the shoulder blade. So moving it down, if you put it between the shoulder blades, you'll actually get a little more lift up into the chest area. It'll lift you up so that you can get a better stretch across the pec muscles, and even letting your head tilt back will open up. So I'm going to just demonstrate that real quick. So you put it there, again, bring your arms out, palms up, and then from there you can do that 3 to 5 minutes with your arms in this like opened up area T, and then you want to move it up into like a Y, okay? Now I'm not getting a whole lot of stretch because my bed is so soft. I would do this on the floor, but I really don't have any shoulder pain. Okay. The other thing I'm going to show you is how to release from the front side. So, a lot of this can be tight and it's pulling you forward, and that can cause strain up into the upper back. So a great way, I'm going to show you this on the left side, a great way to get into the pec muscles in through here from the front is to actually use the ball there. Lie down on your stomach, and you want to bring your arm over to the edge and just let it hang over the edge, okay? And then you can work here. I prefer to not have your head off to either side because it cuts off circulation to the brain. So you want to have face down. Again, 3 to 5 minutes. Okay. The other thing I want to say is that you want to do this very mindfully, meaning really paying attention to what's going on in your body. Okay, that's the best way to do myofascial release. So set yourself up in a area that you're going to be away from your pets, your kids, your phone, TV, and that kind of thing, so you can really focus on what's going on. You can certainly use a wall for some of these as well. So let's say you take your ball to work and you want to work on this, you can just kind of lean up against the ball, okay? And that can be done again anywhere along the shoulder blade, the upper trap area, even into the posterior deltoid and through here, okay? And then another great stretch without the ball is a myofascial stretch. You can use a doorway. This is a really good way to open up through here into that pec area. So you want to stand feet staggered. So you don't want to be putting all of your weight through here. You want to have feet staggered so that you can really control what's going on. Bring your arms up into like this goalpost position. And then what you can do is just very gently lean forward, and I'm feeling it in through here. So 3 to 5 minutes here. Then you can just slide your arms up, and another 3 to 5 minutes. So we talk about T's and Y's. If you can't get into a T position because maybe you don't have the mobility, because it is so painful, what you can do is just come down here, okay? okay? And just start where your body needs it. Not a problem at all. And you work your way up, okay? Always listening to your body. One last thing I want to talk to you about is ways to release the shoulder joint itself. I don't have a shoulder model with me, but we think about the shoulder being like this this ball and socket. So you have this cup here, and you have your humerus as it comes up. So a really good way to release that is through either distraction, where you're kind of pulling that open some and decompressing it, but we also do compression releases. Okay, so a distraction release or a decompression would be, you could do this again, kind of play around with it. I'm going to show you on my left side, but you can bring your arm out to the side, hang on to something nice and sturdy. So this can be done in a doorway, hanging onto a stair railing, even a countertop. And what you can do is just hold on, and then you're adjusting your body, and you're just leaning away and letting that open up. You can open up through this area and really gets into the neck. Okay, again, 3 to 5 minute hold. That's distraction. You can play around with different positions here. I've even had people do something like this where they felt like they really needed to distract that way. So listen to your body. The other way that you can do is a compression. So this is really good for arthritic joints, as long as your body is tolerating it. So that's more of a compression, and it might seem kind of counterintuitive, but the reason we do that is because the body will actually let go or release synovial fluid, which is the lubrication fluid of the joint. Okay, so that can be done simply by pressing into it. This can be done on a bed if you got a good surface, a good height. Otherwise, a countertop or table. And what you do is just you're putting pressure through the joint there, and you're just leaning forward, again, holding 3 to 5 minutes. So these are some great tips. Do I suggest that you try all of them day one for 5 minutes? No. You really need to just maybe try 1 or 2, listen to your body, see what's going on, and be receptive to feeling this in other areas. Your body will release wherever it needs to. If you have questions or comments, please leave them. I will leave them below. And let me know. I will do my best to answer them and reach out to you. Again, I really feel like this is a great place to start. If you're not getting the results that you want, if you're simply not tolerating it, get in and get evaluated by a physical therapist. So thanks for watching.